Welcome to the 25th Annual Spirit and Place Festival, the nation's only arts, humanities, and religion festival. My name is Erin Kelly, and I'm the Program Director for Spirit and Place. We know this year's festival is different than other years, but you're here, we're here, and that's what matters. We'd like to begin this festival with a new practice. That is acknowledging that we are standing on the traditional homelands of the Miami, Potawatomi, Shawnee, and others, people who were unjustly removed from this land. Our origin story as a community begins with them. We also want to thank our sponsors who help make the festival possible: Lilly Endowment Incorporated, Allen Whitehill Clues, Bolson Group, the Indianapolis Foundation, a CICF affiliate, and the IU School of Liberal Arts at IUPUI. We hope you enjoy the variety of events exploring this year's Origins theme. You can learn more about all of the festival events by going to spiritandplace.org. By going to the website, you can also read our community agreements. And these are agreements that we hope you will use to help structure a respectful and mindful festival experience. By visiting our website, spiritandplace.org, you can also take an online survey and tell us what you thought about the event you attended. We rely on this feedback to guide our work and strongly encourage you to go to spiritandplace.org to tell us about your experience. Thank you for supporting Spirit and Place, and have a wonderful festival.
Hello, my name's Ebony Chappelle, and today I am so happy to lead a discussion on the importance of mental health. Today I am gathered with a panel of incredible mental health professionals right here from the city of Indianapolis. We have Dr. Rebecca Mueller. We also have with us Dr. Jamia Jacobson and Miss Erica Grinnell. Thank you all so much for being here.
Thank you. We're happy to be with you. Yeah.
Yes, absolutely. So the theme of this conversation and of the Spirit and Place Festival is focused on origins. So what better way to get started than to ask you all about your origins in this profession and what brought you to it. So Dr. Rebecca, I'll go ahead and get started with you.
All right, sounds good. Well, I grew up in a rural community, a small town, and we did not have a psychiatrist in our town. In fact, we had very few physicians. And, being raised in a multicultural family, the predominant concept of mental health was they just want to know your personal business and you should never air your dirty laundry. So I grew up in an area where mental health was met with much skepticism. And I still recall to this day the first time that we had a mental health professional was a psychiatric physician. He was African American, came to a rural community, happened to come to my church, so that's where I met him. And he was an amazing man who really took on the challenge of rural ideations and the skepticism. So that's when I was first introduced to psychiatry, and I have to give him much credit. I think I'm a psychiatrist this day because of that.
Wow. And I love that story so much. It reminds me of that phrase, representation matters, that you hear so much. So we really, need to see more of that to be able to visualize ourselves in those spaces. So thank you so much for sharing. Dr. Jacobson and then Erica, I'll go ahead and have you guys go as well.
Okay. I came about my route to counseling and therapy a little bit differently. I started out in the era when women could only be teachers or nurses, and they didn't go into business. They didn't get in any other fields much. I had an aunt who was a physician, aunt and uncle, and they kept saying, "Oh, you can do more than that." And I kept going along and doing work and doing my education through emotionally handicapped children and in the teaching field. And then I did an internship at Marion County Juvenile Center in Indianapolis, Indiana. And I sat there and thought, these kids need counseling. They don't need a teacher in school. They need to let themselves be mindful of taking their own self-care and how to do that even. So that's how I got in the counseling field, actually. So a little bit roundabout way.
Wonderful, wonderful. Erica, what about you?
I grew up here in Indianapolis. Both my parents were police officers, so I was raised under a kind of a strict roof. There wasn't really talking much. So when I got to college, I was actually going to go and be an occupational therapist. But I ended up like swerving my way around and talking to an African-American professor up there, Dr. David Rollick, and at Purdue University, if I didn't already say that. But I talked to him, and like it really opened my eyes to mental health and like how important it is to communicate with others and making sure that you're doing yourself good and just like taking care of yourself. That's the important part. And so that's how I roundabout way got my way to psychology, switched my majors and everything, and now I'm here in graduate school trying to be a psychologist.
Awesome. Well, congratulations to you and your journey. We talked earlier about the importance of representation, and it's not lost on me that right now I'm talking to 3 phenomenal women from different backgrounds, different generations are represented here. Why do you think that it's so important for people to have a variety when it comes to seeking help? Have you noticed that your origin, your background has helped you be able to relate to your patients a little bit better? And I'll just open this up to whoever wants to jump in.
Well, I might go with what I've observed and experienced, and that was that as I got into the business, I found that basically I was thinking from a white background as such, and that the cultural and racial kind of sensitivity wasn't there for both sides, and I was on a learning curve all of a sudden. And I went to some of my friends, but only probably in researching this, I think 5% of the therapists in probably the early 80s were in therapy as marriage family therapists and Afro-American or persons of color. So very small, and I started trying to find out, hey, how do I keep sensitive to their home life? How do I learn more about that? And so that I am aware of background and experience.
Who else would like to jump in there? Please, this is a conversation, so we want to keep it flowing. Definitely want to hear from Dr. Rebecca and Erica, you as well, in terms of how you feel that your own origin has helped you to be able to relate to patients. Have you noticed that at all?
I would say that, again, growing up in a rural community and not really having the role model of female physicians, because as I said before, there weren't a great selection of physicians in our area. I remember watching a show called 8 is Enough, and now I'm telling my age here. You got, I don't remember that show, but Mary was the only woman in her medical school class. And I went to medical school in the 1990s, so I figured surely by then the class would be 50-50. Boy, was I surprised.
Wow.
Louisville, Kentucky Medical School, and found myself in the minority as women, in the minority racially. And it was quite a culture shock from that perspective, but very quickly learned that, if you gave your best effort, people really saw your potential. And, again, one of the things that was a bit unusual again in the 1990s was in Kentucky, only 4 women of color took the entrance exam, believe it or not, in the early 1990s. I'm sure for Erica, she's like, wow, how could that be? So I found myself very quickly being on committees that represented minorities of the African-American community. And there was also a time, a great push for recognizing Native Americans, in the field. So kind of got to represent both, and then a woman. So I guess you consider that a triple threat, if you will. But
they said the other day, you're checking all the boxes. That's a little joke from SNL right after the election.
And I am a fan of SNL, and I have to tell you, I think that they do a really great job of handling tough, sensitive issues that we're facing today. But that was kind of an interesting cultural experience for me. I didn't anticipate it, but certainly embraced it.
Wonderful, wonderful. Erica, what about you?
That just made me think about a couple of clients that I've had. Since I'm from Indianapolis, I have a little bit of a lay of the land, and I've been able to connect with some of my younger clients who are like going to school, and it's just really interesting because I interacted with one and I told them that I graduated from Ben Davis, and they were like, "What?"
Wow.
And
I graduated from Ben Davis also.
Oh, cool. Oh, yeah. There you go. Yeah. So that was the point, like they weren't really opening up in therapy, and then that was the point where we were able to communicate. They opened up a little bit more about their mental health needs and things like that. So I think it's really important to have representation in all areas.
Mm-hmm, mm-hmm. Yeah, something else that I've noticed recently is that more people are warming up to the thought of seeking professional help when it comes to their mental health. I know growing up, I was a young girl that was put into therapy by school when I was a child, and really, equated therapy with like punishment or being in trouble of some sort. So it wasn't until I was an adult that ideal began to change for me, and then I sought therapy on my own. But it really took, that's 20 something years of time before that was able to happen. And there are so many other people that have very challenging thoughts, sometimes negative perceptions of the industry. And I just wanted to hear from you all, how have you seen the shift? Now we have online things. They have stuff like Talkspace and all these other avenues. And it seems like something that a lot of people are more comfortable with these days. How have you witnessed that shift in your own professional journeys? Not everybody all at once.
Yeah. Well, I think there has been a huge change. First of all, we are, recognizing things from gender to race to, LGBTQ, to sexual orientation, and that could not have been talked about, and was considered totally something we kept very quiet and didn't.
Especially because in the DSM, same gender loving people were considered like you had something, it was considered a mental disorder, and now of course we know that that's not the case, but yeah.
So I think that's been a whole dimension that has certainly changed, both for the therapist and in our field as medical or anybody dealing with, I think, patients and clients. So, and I think we have to be more aware also of the experience that our client or patient brings to us, their life experience and where they're coming from. And that's been a little bit of a change too through the years, I think, as well.
Yeah, of considering their experiences as well. Wow. So do you think that before it was more of a transactional type of experience, like you just come in, we talk, and then I, diagnose you and you move on?
Right. And I think we at first and years ago used to be able to spend much more time with a client. So we let them actually probably interact and talk more about anything. And suddenly I think our insurance world changed much of what we do. And they suddenly said, "Oh no, you only have 4 sessions," And so you really began to try to ask the questions that would get them to express what their experience really had been.
I've seen that trend as well. One of the difficulties of meeting new patients is, being a physician, we're looking at medical workups and medications if warranted, but for people who present with mental health symptoms, and sometimes they truly are mental health issues, and sometimes they may be hormonal changes or other medical conditions that mimic mental health symptoms. But I think as a diagnostician, the most important part is having that time to establish rapport, to get the person to engage and trust you. Because unlike many specialties where someone comes in and their arm is swollen and you take an x-ray and yep, you have a broken bone, behavioral sciences is completely different. Ours is a time focused industry, and I have to agree, we've been presented with lots of challenges because of constraints of third-party payers. And I think for folks like myself, I've been in practice 22 years. There's a saying, you can't teach old dogs new tricks. I attest to that because I had to go out of network just because trying to do a diagnostic exam in 30 minutes for me was impossible.
Wow.
And I think that we owe our clients and patients the best care that we can provide. And that means time. Sometimes you need 3 visits to figure out what's going on with them rather than a one designated, diagnostic assessment. So I think that time constraints have been an issue, but to speak to the online presence, prior to COVID, we found that people were interested in virtual visits just because it's a busy world and we have technology. Now we're in I don't think we're in a post-COVID, so I'm going to say a period.
Not the way these numbers look.
So maybe we're going to thank COVID in the future for changing how we do provider care. But I think even more so now, as Ms. Chappell said, we are dealing with online presence, online requests, and it's been a bit of a challenge. But I think maybe Erica, being in the younger generation, would be able to speak to that a little bit better.
Oh, yeah. There's a little bit of an echo. I don't know who it was, but definitely, I can see a lot of clients actually preferring the online. They're able to adapt it more to their lives and fit it into their schedules better than actually coming in and sitting down in session. I can also speak to it on the other side because mental health is important. I've also seen that I'm more likely to schedule appointments for mental health reasons as well over Zoom and things because my schedule changes a lot. And then just being accessible, that's really important for mental health, and I think that our clients really appreciate that as well.
Mm-hmm. Mm-hmm. Yeah, as a client, I certainly appreciated it.
Yeah.
Certainly appreciated that flexibility. And you all have brought up this thing that we're living through, continue to live through, that there's no clear end in sight, and that is COVID. We, in March, we were, hit with this news. It seems like all of a sudden that, we are living in a global pandemic. This highly contagious disease is everywhere. We don't know enough about it. And it completely changed the world and changed the way that we live our everyday lives, a lot of us. Do you all have any reflections on 2020, not only with COVID, but we dealt with a lot of civil unrest. We dealt with huge, news in the political world as well. And just on top of the things that people already live with, their everyday life in general. Any reflections on that from a professional perspective? Any thoughts that you all would like to share?
Well, I think one of the things, cultural and kind of racial sensitivity is on both sides, every place. So that suddenly, I think, came to the forefront too, as a therapist, that we needed to be aware of that. And COVID certainly made it as higher and closer to us as we saw more people who had anxiety. They were anxious about their surroundings, about their health. about their mental health, and the anxiety was very high. And at first, that's what we were dealing with on almost a constant basis. Not to even get into the medical side yet on that. So that was something we noticed right away as COVID came into being, and people were shut away from other people at home and with a family, sometimes not, or unable to see their family, which became even more anxious, causing. So that kind of changed I think I noticed. I don't know, Erica, what you think?
Yeah, a lot of anxiety and acting too, and a lot of depression as well. Staying inside has been really hard on a lot of people. And then also as for like the civil unrest and stuff like that, I've had clients coming in and being anxious because I am a woman of color, and either being like, oh, I'm not like that, or like, I can better relate to you because of this.
And when you say I'm not like that, could you elaborate a little bit?
Yeah. In the sense of that, like, I'm not racist.
Oh, so some of your white clients. Wow.
So I that too.
Yeah. Dr. Rebecca, did you notice anything like that? Like any of your clients wanting to, assert, I am not racist, just to let you know, or anything else from this time that you want to reflect on?
A couple of thoughts. Yes, I was surprised by the number of patients. Again, been in practice for 22 years. I have lots of patients, and just honored to serve the people that I do. And for people to reach out and say, hey, I went down to protest, and I was moved to tears. I was honored. There were times I was afraid because I thought, okay, the protests are not really safe places, but just people wanting to know, I'm supporting Black Lives Matter, and I'm supporting, the efforts against racism and prejudices. And in addition to that, one of the things that was unique, our practice, we work a lot with international adoptions. And so what we found was we have often Caucasian families in rural communities that adopt children from different countries, different ethnic backgrounds, and certainly some that are U.S. Adoptions of color. So you have these children that are maybe the only person of color, whether it's African American or Asian or Hispanic, whatever, in their class, and they're learning, surprisingly, for the first time, what racism is like. And I don't want to monopolize the conversation here, but this was an interesting situation. I had kids that came in and they said, I didn't realize that things that I was experiencing in school, it was racism. And because it was unfamiliar, I didn't recognize it until a lot of this hit the media. So that was an interesting phenomenon. And what we then found was some of our school systems needed cultural education. They needed to learn about diversity. And so the schools, several of them took that platform of, we're going to start educating our teachers about appropriate conversations to have in the classroom. I know it might be shocking in 2020 that this is where we were, but it happened. So in the era of this unprecedented year of unrest and fear for sordid reasons, maybe something positive came out of it, and that was a new generation that was unfamiliar with racism, but they were victims of it. And the positive part is the education.
Mm-hmm. Very powerful, very powerful. I too have been inspired by the level of education that people have sought during this time. And I just wonder, for the three of you as professionals, what role do you feel that the mental health industry plays in all of this that's going on? I mean, you guys have been having conversations with your patients, so that's, your individual contribution. But what contribution does the industry as a whole owe to this time that we're living in right now?
I guess personally, as a therapist, I find it very helpful to help the client or patient reframe these negative kind of assumptions that they've had, and just been inculcated within their society, just ingrown. And I think that's been the biggest thing. I also think that probably with the social action, it's good to let people know this is challenging, the thoughts and processes, and it may be uncomfortable. And that's okay, but we need to look at it a different way and think about this now in more realistic terms of what is going on, what has gone on, and how we can make it better. So I think that's been something that also has been important through all this.
Yeah, absolutely. Erica, what are your thoughts on that? You come from an interesting perspective, being, currently being a student, but being somebody that's also in practice as well. What are your thoughts?
Yeah, just reframing everything is really important. There's a lot of negativity going around, and just being able to take our clients and be there for them and being able to communicate with them, it's just really important. Sorry, I feel like brain thoughts.
No, it's all good. It's all good. That is a shared symptom of 2020 that we all have. So totally understood. Yeah. Dr. Rebecca, you mentioned something earlier that I want to go back to, and that is you expressing some of the challenges of working with third-party payers and having to go out of network for some of the things that you wanted to offer clients. One of the things that I've heard people say so much is that, people don't seek therapy. They don't think it's important. Oftentimes that's attributed specifically to people of color, that they don't think that it's important. Why don't they think it's important? And one of the things that I've noticed is that seeking mental health is not super easy. Sure, we have the online stuff, but a lot of this is very inaccessible. And in addition to being inaccessible, extremely expensive. What do you think needs to happen at an industry level to make it more accessible to more people? Because right now it just isn't.
Well, I grew up in a state, Kentucky, where we had parity, and that meant that the insurance companies had to offer equal medical and mental health benefits. Indiana does not have parity, so you could have a great medical policy that offered absolutely zero coverage for anything related to mental health. And because of that, then you're looking at paying for everything. You're paying for all of your appointments for therapy, you're paying all of your appointments for psychiatrists. And, in our practice, we advocate for people to see therapists because we think that is more important. I'm actually in a supportive role. So my philosophy is find a therapist, commit to therapy. You're going to see them often because that's how you get better. And then I, as a psychiatric physician, I'm in a supportive role of assisting the patient and the therapist. And that to me is mental health. So the problem that you run into is you may pay $150 per session for therapy. If you're seeing a therapist every week, every other week, boy, that quickly adds up.
Yeah.
And when you don't have an insurance company that is going to cover those visits, you may find a great therapist want to be actively engaged on a regular basis and just, I'm out of funds. So that's what we've experienced.
So is there anything, hold on, there's a little bit of it. Okay, let me try again. Okay, I'm getting an echo really good. And Lakeisha, you're gonna have to cut this out, but back to that question, Dr. Rebecca, what do you think, is there anything that the industry can do to try to address that issue? We know the constraints that come with, insurance and things of that nature, but is there anything that the industry can do to address it from them?
I think one of the things that we've had happen You know, it's a tough topic. This has been a year of everywhere you turn, you can't get away from the deaths that have happened due to COVID. And so we've supported support groups that are meeting in churches, and some hospitals are allowing, the facilitators to use space there at no charge. So just efforts to find support groups for people who have had losses, depression, and even if you haven't experienced a personal loss, just the fears and the uncertainties of what is happening in this pandemic. And so those opportunities have kind of cropped up here and there, and I'm really excited about it. What that also shows us is we need those same sort of services for people who cannot afford mental health care for other areas, such as depression, anxiety, substance use. And Ms. Williams asked me earlier if we could talk a little bit about opioid addiction, and I'm just going to touch on this and then, let everyone jump in. But in this day and age, we know that we still have an opioid crisis, and trying to find support groups, trying to find mental health care outside of an anonymous group such as Narcotics Anonymous, Alcoholics Anonymous. There's just not a lot of services. And I'm a big believer in 12-step programs, including Celebrate Recovery. All of those are free programs, but for some people, they want to be able to deal with what we call dual diagnosis, which are opioid or drug addictions, alcoholism, and primary mental health disorders such as depression, anxiety, things like that. So as a community, I'm just encouraging and challenging those of us that are in mental health to find a time when I know we're super busy and overwhelmed to just connect with the community and see where we might be able to offer some support. And I'll mute if that might make it a little bit easier. Let me do that.
Yeah, but thank you so much, Dr. Mueller, for offering that suggestion. Dr. Jacobson, Erica, any thoughts on that as far as just getting involved in your own way to help support?
I on the fact of substance abuse, I think it took so long to address it, and suddenly we finally are addressing it, that there is indeed a problem here. I can remember when I was asked by 4 medical doctors to come in and set up a program on therapy for substance abuse users, and they said, oh, you only have to do it a day a week, but you do the protocols for the, and I said, well, I can really do that and do the protocols. And then I got in there a day and I came back to them and said, wow, this is really big out there, and we need to be paying more attention to this. And it turned into a 7-day-a-week practice. And so it grew really for that. So I think even recognition and that kind of thing, of the issue, of what is going on, is important.
Mm-hmm. Mm-hmm. Yeah, like Dr. Mueller was saying, the community outreach piece is really important too, because not a lot of people know the services that are provided by us. So yeah, it's really important to get that out there.
Absolutely important to get that out there. And speaking of community outreach, I want to offer you all the opportunity to just give a message to the community. The theme of Spirit and Place Festival is origins. For someone that is maybe considering seeking some mental health help, whether that be through a support group or sitting down with a psychiatrist to be diagnosed, or going to regular therapy, etc. What are your thoughts on how going alongside a professional in a mental health journey can help you discover your own origins, and whether it's some reconciliation that needs to happen, some healing that needs to happen, etc. What are your thoughts on how a mental health journey can help you figure out your own individual origins?
I'll jump in, but I'll be interested to hear what you both have to say. But I think when American Behavioral Counseling got started, we adopted hope as kind of our term that we were going to use because there's always hope. And it's there 24/7. And we are there to help you explore the origins and the issues. We are there to help you become even more satisfied with your life. And I think that community outreach and this kind of community outreach, just letting people know that there is help out there and there is hope. And, you know, we are there. I know there aren't enough of us yet. And I know we have a terrible time finding psychiatrists. So I'm so glad to know Dr. Mueller. But that, I think, too, we just need this wonderful outreach that's happening right now.
I think discovery is an important piece of it, too. Whether they come in to, like, talk about their lives, or just come in for specific anxiety, depression, or anything like that. It's still going toward their story and them trying to figure out who they are as a person, which will go back to their origins and hopefully help them become a better version of themselves. And then also that community outreach piece for what we're doing here today. It's important for us to reach out there so that they'll be able to come in and be able to start that journey for themselves.
You know, I absolutely agree. Origins is so important. I remember when I was growing up, my mother used to joke about, you know, one day just kind of, you know, being able to process, you know, these life events. And the reason I said, you know, we would kind of joke about it is once we were introduced to mental health, we were like, we need more. And it's interesting, in 2020, we're still saying we need more. But certainly, you know, mental health has come a long way. The stigma is improving every day, and I'm so grateful for that. But origins are so important, which is why I'm appreciative of this platform that Ms. Williams put together. We're all product of our environments. I know that may sound like a cliche, but we are. We're products of our upbringings and experiences we've had. And it shapes our adulthood, it shapes our future. And, you know, when I was a psychiatry resident in the Stone Ages, we were actually, they're like way back when, we were actually encouraged to be in individual therapy as we were in training. And one of the things that I enjoyed most about my training was group therapy. We all were in group therapy with the psychiatric residents and our psychology interns. We all had group therapy together every week. And it was the most amazing, rewarding experience I ever had. And I learned so much about myself, but I learned so much about just other individuals that I work with every day. And I really regret that we are in a fast-paced society, and I know that we have to change. It's good. It's good to be in a fast-paced society. I know there's many benefits, but I too came from an era when you sat down and you had group meetings for an hour and a half, and you processed afterwards, and you really got to know each other. And in the same vein, you got to know your patients or your clients. And it was an experience that I think still shapes our concepts of mental health today. We have to do it a little faster. But I think the important part is, even when we are in time constraints and having to worry about people's budgets, I'm going to really be forthcoming here. I worry constantly about people's budgets. We do a lot of in-between care because of that, and that's necessary. But the most important part is hearing people in the moment. Sometimes, and I'm cautious here, especially for younger people, because I don't want them to think, great, I have to give up all my free time. That's not what I'm saying. But I would encourage you to be available, even if you have to see people on short notice, because when they're in the moment, that's when you learn most about what's happening with your client or patient. And so that's kind of a long-winded way coming back to the origins. I think that knowing the origins and knowing where people are in the moment that really shapes how we take care of people. And I feel like a politician, I'm going to yield my time here to the lady.
Well, what a great way to wrap us up. I want to say thank you to each and every one of you for your time. Dr. Mueller, you mentioned about us being in a fast-paced society. Me personally, I hope that we're able to slow down a little bit because time to process is so important. It's so important. We are rounding out the end of this year, and I just want to personally encourage everyone to try to find some time to slow down if you haven't yet. Just to think through all of the things that we've experienced and what it is you want for the future. So I just want to say thank you again to Dr. Jacobson, Dr. Mueller, and soon to be Dr. Erica for your time today having this conversation on mental health as a part of Spirit in Place Festival, presented by Get a Grip Counseling and American Behavioral Counseling Services. Thank you all so much. And thank you all for tuning in. Take care of yourselves.